telehealth has been an important instrument. We're still doing that, obviously for those with COVID cases, but other times it actually helps patients be able to have flexibility if they can't, get time out from work or childcare or whatever. So that's been a pretty good avenue to have as an option for patient visits.
Having to pivot and do telehealth and work remotely also forced us to create some efficiencies. We had to go electronic. We had to quit pushing paper around. So that's a great thing, and that will persist.
They just like the telehealth visit. They think their child acts more authentically like they act when we're not coming in, because when you're coming into somebody's home, you're already creating that artificial environment. You're not there, and what we're looking for in coaching and early intervention is authenticity and seeing things as they're happening throughout the week when we're not there. And so that has been a really big benefit.
One of the things that I envision is after-hour care, and telemedicine can really come in handy as far as for those individuals who can't make it to Old Town up until 5 or 6 o'clock, Monday through Friday.
All the patients, even young and old, they seem to really like to be able to just message us, where before it would just been so many phone calls. So yeah, I think that's been another advantage to it. Things are quicker paced, moving faster, using technology to our advantage.
The farmers market is comprised, in our case, of 70 individual businesses. I had an online platform set up for them. The upside was vendors who had items you may skip by at the market because you didn't really know what it was, or you'd never tried it before, but because you were looking at the pictures online, all of a sudden you were more willing to try this new item, and those vendors have seen a dramatic increase in their sales.
The Restaurant Association, there was a lot of collaboration on procedures, how to maximize our space, and how do you do takeout dining? Well, we do it this way. How do you do online ordering? We use this. There was a lot of back and forth that really helped.
The community collaboration, the partnerships, it's just been incredible, because I think pre-COVID, we didn't mean to get siloed, but I think that we all get in our own world. It was really neat for seeing all of us be able to communicate in a way that really we didn't have a need to communicate like that before.
We wanted to make sure that we're still able to reach families that struggle with transportation. And we were very fortunate to get 2 pretty big gifts from local foundations that allowed us to purchase a truck that we use specifically for receiving, transporting, and delivering meals right to kids in their homes. It's just one of the best things that has come out of this pandemic, and we're prepared to continue doing this going forward.
We've always had a great relationship with the schools, but what I saw over the pandemic was that the key word was coordinated. Every time there was a change about to come, we would talk about the impact to the community, to the kids, to the families, because they're the same families that we're both serving. So I see that already staying. We've already talked about having more coordinated meetings.
We'd been striving for years to be a one-to-one, one laptop per child school division. So we were able to work with our partners, get the devices in. We distributed somewhere in the neighborhood of 9,000. And that's something that I think is going to stay, because that's something we'd wanted to do anyway, was to be able to provide that tool to our students to support the teaching and learning process.
One of the positive wins is we will be able to help children that in the past we could not help have the instruction from their teacher of record. They're going to actually get instruction from the teacher in real time, because we'll be able to use instructional technology tools to do that. And that will be a game changer.
In the pandemic, because we started seeing more students reaching out for more intense help, I expanded a program that we have in the Tutor Zone. It's academic coaching. We expanded it to now include 12 graduate students who are academic coaches, and they are able to serve way more students in an academic coaching capacity than before. And not only is it a better, more available resource for students now, but it also is great experience for the graduate students. We've got a lot of people in the program this semester, which is really satisfying to see. I think that'll continue to grow.
I think the most important thing we've learned through this pandemic is the ability to be flexible and fluid in our work. So, our role in human services is to meet the economic, social, emotional needs and physical needs of our community, and we just need to continue to be flexible and creative in our interventions.
I do think our clients are okay with not having to come into the office. If you're working full time, or you have children, or you maybe don't have the most reliable transportation, how much easier is it for you to call over the phone? So I hope that a lot of that sticks around, because again, I do think it's client-centered.
We had a significant increase at our convenience centers. So we were running into staff shortages. And with the ever-changing personnel, we came up with and streamlined our training module. We have that in place, and we use that now for our onboarding.
I can't think of a single aspect of anything that we implemented that's not still in place, that doesn't have some sort of future use. I can't think of a single thing that we did that was just for the pandemic only.
I know a lot more businesses know we exist, so I think they see us much more as a broader resource than they did before, and problem solving with them, and just a deeper relationship that I think we all feel throughout the community.
We were able to reach adults that we normally didn't reach because they were so busy investing in their children. So we had adults in virtual genealogy classes. We had adults doing exercise programs from their own home. So those are the types of things that I know that we will keep.
Curbside service. It made it important and necessary for us to be able to get people material without having them come into the library. So it had been a service we'd been talking about starting, and we kept on wondering, how do you make this work? And the pandemic actually made us figure it out. That's a service that I think will be continuing.
That's something that we're looking at doing regularly, where we designate some time every so often to say, here's a parkway and it's car free and you come ride your bike or walk. And that was spurred on specifically because of the pandemic and because of this opportunity that people saw to go out there and experience that in a new way.
We pivoted to a very heavy digital presence, and that proved to be a very, very successful adaptation for us. We had audience members that were across the seas. They were in Europe. They were, across the country, and perhaps will never make it here in person. So we have now gone to a little bit of a hybrid experience, providing online educational opportunities, but also on site.
On behalf of our board, thank you for watching our annual awards event. You are leaders from different sectors and diverse organizations, public and private, profit and nonprofit, and government. It clearly illustrates that the health of our community and those who live in it is a shared responsibility. It rests not only on those who provide health care, but also on city and county officials, educators, public health professionals, and many others, and of course, each one of us individually. The Health Foundation began in 1996, a partnership between Williamsburg Community Hospital and Centera Health System, with approximately $55 million in assets. To date, we've distributed over $90 million, and today our corpus stands at approximately $145 million. I'd like to hand over the program to our Health Foundation's President and CEO, Carol Sale, to talk about the theme, Lasting and Positive Adaptations because of this pandemic.
Good afternoon, everyone. As Jack mentioned in his remarks, the theme of today's event is Lasting Innovations Beyond the Pandemic. Through the course of our work during 2020 and the entire pandemic to date, we at the Williamsburg Health Foundation have seen so many bright spots in dark times. We saw entrepreneurial thinking, new ways of reaching out to each other, new ways of doing business, new ways of helping those in need. We felt privileged to see so much good work, and we want to celebrate it. As part of our efforts to be accountable and transparent to our community, we issue an annual report to the community. As in past years, we published our report in the Williamsburg Next Door Neighbors magazine. It is also available on our website. Our community came together in so many important ways last year. This report celebrates that fact. Today's annual awards will celebrate not only what we did, but also what our community will carry forward with us as lasting change beyond the pandemic. The Williamsburg Health Foundation's mission is to collaborate, innovate, and invest to impact systems that improve the health and well-being of individuals living in the greater Williamsburg area. And our vision is individuals making healthy choices in a community with health opportunities for all. I am honored to lead the foundation as it strives to realize a community in which there is health opportunity for everyone. Now, I'd like to turn the annual awards program over to the Health Foundation's External Affairs Committee Chairman, Glenda Turner. Glenda?
Thank you, Carol. As you saw earlier in the video shorts, this community responded to the pandemic in a variety of inspiring ways across many sectors. Those shorts are also available on our YouTube channel. This community has always been collaborative. People are good neighbors to another. We strive to be kind as a community. COVID-19 made that even more true. It made us reach across organizations and across sectors and across barriers and divisions that we were reluctant to cross before. Now that we have made those connections, it has made us stronger and nimbler as a community. While there were innovations in so many sectors and by so many organizations and individuals, today we want to highlight the emergency management professionals who helped lead that collaboration. They helped all of us get accurate information about COVID-19, and they helped us get vaccinated. They put aside competing pressures to do what was best for our entire community. As you will see, their work is inspiring.
COVID-19 has provided a means to be more resilient and to quickly adapt. We learned early on that we may start down one road to implement a procedure this way. When the pandemic started and realized as things change, we had to pivot and deal with it in another way. I think even though we've gone through a pandemic, we have also benefited from unique and creative ways of operating in the workplace and ultimately providing services to the community.
Operation Vaccinate the Peninsula involved the collaboration of the 6 Virginia Peninsula localities, the hospital systems, and the health district. And I think, in the history of the COVID response, that's going to go down as just, a really amazing tale of people overcoming all of their competing pressures that every locality has to do what was best for the region.
But in terms of communication from our utility staff to our police and fire staff to the managers to our elected officials, I think we really do collaborate and work well together. The pandemic really highlighted that. I was on daily or weekly calls with all the chief administrative officers across Hampton Roads for a period of time. We talked continuously. We had our staffs talking continuously. So I'm really proud of how all of us have come through this. I think stronger and better together and a little more understanding of one another.
None of us could do these things on our own. So we really did rely on each other at the local government level. But then we also found out we have a huge asset in our community that maybe we didn't utilize as much in the past that I think we can utilize more moving forward. And that's both the church organizations, the local nonprofits. There are so many organizations out there who can get into some of these communities and relay information, whether it be about vaccinations, upcoming weather events. You know, there's a lot of things that go on in the county where we sometimes struggle to get that message out to everybody. We found out that they're really good at doing that.
So my hope is out of this whole entire mess that we'll be able to continue some of those relationships and that I'll be able to build within those community partnerships some sort of general emergency preparedness for these groups targeted to them so that they can be a little bit more prepared for disasters of any sort. Because I don't want to lose these partnerships that we've built over the last year and a half that have been very valuable, and I'm definitely looking forward to working with them more in the future.
I would say that prior to the pandemic, it would be easy for an administrator of a local government to say that the opinion of government generally was at its lowest. And the pandemic really gave local government the opportunity to demonstrate its capability. And I hope in Williamsburg we did. And I think coming out of it, what we've done is through the forged relationships, the forced relationships with the business community, with the residents, and with our strategic partners, both other